And good day. It's time now for your health, the presentation of Medica Pharmacy. And Alyson Schwartz is with us today, and this is a pre-recorded show for those on radio or cable. And Alyson, on this still pretty nice looking day.
Yeah, a little overcast, but it's beautiful, warm out there, so it's an enjoyable walk up here today.
Good deal. And as we will go into some other subjects, exercise is always a good time. It's just a little easier to do when it's weather like this.
It is, yeah. We tell people you burn more calories in the winter because your body's trying to stay warm, but it's just a lot, yeah. Nobody really likes to go out. This winter was awful. Who really wanted to be out in that? I didn't. I admit I didn't exercise near like I normally do this winter, so guilty.
We are going to go on to a subject today that we've been on before.
Exactly. We're going to talk about testosterone therapy. And we mentioned it once before, and the reason I wanted to do it again is because for any of you guys that watch TV, which I know is most people out there, surely you've seen the ads from all the different law offices saying if you've been on Androgel, Androderm, Axiron, Testim, all these testosterone therapies, that you might be entitled to a class action lawsuit settlement. So the law offices are, basically telling you there's been some very bad adverse effects, and so maybe you should call them to see if you're entitled to any compensation for being on these therapies. So wanted to kind of think, go into why maybe that is.
Okay.
So when you use testosterone therapy transdermally, they're starting to see that you have increased risk of blood clots, heart arrhythmias, high blood pressure, heart attacks, and actually just an increased risk in overall mortality, which is death. And nobody wants that.
When you say transdermally,
that means on your skin. So
lotion or something.
Right. Exactly. So most of the commercially available testosterone therapies, there is an injectable, but most of the ones that we see used are the androderms, the androgels. They're either in a gel, a lotion, a patch, and then the Axiron actually is like almost like a deodorant stick that you put on underneath your arms because you have really good absorption in your armpit area. So that's transdermal. Anything that's applied to your skin that you don't take orally, rectally, vaginally is considered to be transdermal.
Okay. So is it dangerous?
If it's not done correctly, it is. And I wanted to kind of talk about why that is. So, we got to look, and most of the time when we're using these prescription testosterone therapies, guys are getting 40 to 80 milligrams of testosterone a day. Now, milligrams not a lot, so you're thinking, well, is that really a lot? Well, natural production of testosterone peaks at age 20 to 22 years of age. So guys in your prime at 20 to 22, I'm sorry that it's at 2022, but that's when it happens. You produce 5 to 10 milligrams a day of testosterone.
So 4 to 8 times as much as...
Right. So you produce 5 to 10 milligrams. We're dosing testosterone in 40 to 80 milligrams. And part of that's, you see the higher doses because we measure testosterone levels most commonly in the blood. The problem is testosterone doesn't always accurately show up in the blood. And the reason for that is of all the hormones you make, men and women make the same hormones just in different levels. So you make 3 estrogens, you make testosterone, you make progesterone, you make DHEA, you make cortisol, you make thyroid hormones. Testosterone is the most lipophilic, which means it loves fat. Okay, so testosterone stays in your fat for a very long period of time. So only 2 to 4% of your testosterone shows up in your blood, which is mostly water. And the testosterone that does show up in your blood is the free hormone. So 2 to 4% of free hormone. And that's all that you're seeing in the blood. So you're given, and it's the same in women. When you dose hormones on the skin, you do not see it reflect in the blood values. So we've got to find a better way to test these guys. So we use salivary hormone testing a lot. It's very accurate of testing these transdermal therapies. So if you're on a topical skin-induced transdermal form of hormone, then you need to test it in a salivary component or something other than blood to get a really good, accurate depiction of what's going on.
A swab of the mouth?
You have a little 5 milliliter, like a teaspoon, that you would fill up with your saliva.
Okay.
And so, when you look at it, you actually think that's a lot of saliva. But most people, because we do them out of the pharmacy, it usually takes anywhere from 5 to 15 minutes to fill that little tube up. And then you mail it off to the lab, and you get your results in a couple weeks. And it's been very interesting to see some of the guys on testosterone therapy whose lab blood work is showing no improvement, and they're perfectly normal, sometimes elevated on the saliva test, but you'll see there's other hormone imbalances in that whole cascade that's causing a lot of these symptoms. So that's one thing. So why do we all need this testosterone? I mean, testosterone, it's needed, but as you age, it declines. And that's normal. So after you peak at that 20 to 22, you decline about 1.2% every year. That's natural. And over your lifetime, you're going to lose about 47% of your testosterone. Now, since 1987, starting in like the late 2000s, they actually have seen that men generally have 15% lower levels of testosterone. So they don't really know why that is. They're also seeing men have lower sperm counts. Not sure why that is other than maybe toxin related. So there's a lot of research into that. Men usually have like a 40 million sperm count, and we're starting to see, I think I read 20% of guys 18 to 30 have a less than 20 million sperm count, which is pretty low. So that, of course, obviously causes fertility issues. So what would cause low testosterone? We just talked about naturally it declines as you age. Stress. We all know that we're under stress, and we've talked about it before. Stress is physical, mental, environmental, illnesses, bacteria. When your body is under stress, it is surviving. It's fighting for your life, and it is not interested in whether you reproduce or not. So it is not making your sex hormones. So that causes low testosterone.
Put that on hold while we take
right.
care of it.
If you're running away from a tiger, you don't really need testosterone at that moment. So, and the brain doesn't differentiate everyday stresses with, fighting for your life from running away from danger.
Did you just make that up, or did you read this?
I said, well, I've heard it. So many of the functional medicine doctors are like, well, if you're trying to run away from a tiger, your body's not worried about reproducing, and it's true. So, and it's the same with women. You don't want to procreate when you're trying to save your life. So you don't need testosterone then. Estrogen dominance. And we talked about on my last testosterone talk about how a lot of guys convert testosterone to estrogen. So estrogen increases with something called aromatase activity. Every person has aromatase, which is just an enzyme in your body to convert testosterone down the normal cascade. But it converts it to estrogen. Now, estrogen can also convert back to testosterone depending on the situation. But if you have too much aromatase activity, which we'll mention in a minute, as you get older, as you are increasing body fat, specifically stomach, abdominal fat, high stress, you're going to increase your estrogen levels. We've talked about with women the xenoestrogens, certain lotions and plastics and chemicals in the environment increase your estrogen levels. If you have, you're an older gentleman and you are married to or have a woman partner who is on a transdermal estrogen therapy, if she's not careful, as she's hugging on you or sitting next to you, she could transfer her estrogen to you through your skin-to-skin contact, so that can raise your estrogen levels. If you drink a lot of alcohol makes you aromatize the testosterone to estrogen. And if your liver is not properly able to detoxify the extra hormones, you'll get extra estrogens, all leading to the estrogen dominant. So we mentioned body fat, so obesity, sign of low testosterone, and specifically the belly fat. Inflammation. Any disease that causes inflammation increases that aromatase activity, which converts testosterone to estrogen. Lots of toxins out there. And then this one is huge. We've talked before about how many Americans are on medications. Lots of medications lower testosterone. Men that are on statins for cholesterol, lovastatin, simvastatin, pravastatin, atorvastatin, which is Lipitor, and Crestor, are 3 times more likely to have low testosterone. So, and then what's interesting is low testosterone actually causes high cholesterol. So then you're going to lower the cholesterol by putting you on a medicine that's going to make your testosterone go any lower. So that to me is a huge vicious cycle that somebody needs to look at a little bit further to see kind of what's going on there. The SSRIs, which are antidepressants like Paxil, Prozac, Celexa, and Lexapro, lower your testosterone. Certain blood pressure medications, certain pain medications, specifically the opiates, which are the codeines and the morphines, those that lower testosterone levels. And then actually men with low testosterone are more prone to chronic pain. So again, another vicious cycle. All your corticosteroids, prednisones, methylprednisones, those lower it. Cimetidine, which is generic Tagamet, which is the lower stomach acid, lowers testosterone. Spironolactone, which is a diuretic, a lot of seizure medications, and the vast majority of antibiotics. All of those lower your testosterone levels.
And lower testosterone level usually means higher estrogen level?
Sometimes. It's not always, but it can lead to, because usually, and that's what we're seeing a lot of, is a lot of times the reason you are not making proper low testosterone is you're converting it to estrogen, or You're so overstressed that your body's producing high levels of cortisol and it's not cascading down into the normal hormone production. So when you have low testosterone, the other issues that you might see is metabolic syndrome. So metabolic syndrome is that whole cascade of high cholesterol, high blood pressure, you're obese, your blood sugar's too high. That's the metabolic syndrome. So all of those things have been linked to low testosterone.
Well, those are all things that can lead to fatal health issues.
Exactly.
Diabetes and heart attacks and everything.
Right. And this is why it's so important that you don't just have one disease. I mean, all of these little diseases, the high blood pressure, the cholesterol, they almost always have that one underlying thing that you've got to fix. And by treating all the symptoms and putting you on all these medications doesn't necessarily get to the root cause. And we're seeing the same thing with testosterone. Testosterone is linked to cardiovascular disease and erectile dysfunction. Now, there's a link there. Erectile dysfunction is a sign that you have cardiovascular disease coming. Typically, if you are diagnosed with erectile dysfunction, within the next 3 to 5 years, you'll be diagnosed with cardiovascular disease. So guys with erectile dysfunction, don't just go out there and get put on testosterone therapy and get put on Viagra or Levitra or Cialis because you're not treating what's causing the issue.
You got a blood issue.
Exactly. So you don't want to end up with erectile dysfunction and try to treat just that, and then the next thing you know, you have cardiovascular disease. So really important thing to know. Obviously, if you're low on testosterone, you're probably not going to have the best sex drive in the world. You know, that's normal. Men with low testosterone are more likely to be iron anemic. It's an absorption issue, so they tend to be more anemic. They tend to be depressed, irritable. They don't have as good cognitive function, so they have some memory issues. And then we all know bodybuilders use steroids, so low testosterone, low muscle mass, and less muscle strength. You're more fatigued. And then one of the telltale signs, especially in some of the more overweight men, is they get what's called gynecomastia. And in layman's term, that's man boobs. So you get growth of breasts in men. And it's, a lot of men are very embarrassed about it. That is a huge sign of low testosterone.
We started off talking, though, that there may be a danger to high testosterone.
Right.
But we talked about the significance of it having correct check of what our level is and maintaining that level. How is there a safer way than applied on the skin, whatever that long term you use?
Not necessarily. And the reason that I talked about the aromatase and how that causes you to convert testosterone to estrogen, and you see that with age and stress and weight, belly fat, zinc deficiency, inflammation, and if you drink a lot of alcohol. Well, so the key is if your testosterone is low and you do need to replace that, you got to find the source of it. So one thing is, if you're going to use that transdermal cream, you need to have something to block that aromatase. You want to stop the conversion to estrogen. So there's something called Chrysin. So not all guys some guys don't, insurance doesn't pay for the commercial available testosterones, and they're very expensive. We actually compound testosterone. So the vast majority of the time, we will put what's called Chrysin in with our testosterone creams. Chrysin blocks aromatase, so it helps to stop that conversion of testosterone to estrogen. You can also increase flax into your diet, and you can make sure that your zinc level is okay. So, zinc supplements, flax, and Chrysin all are natural aromatase inhibitors. If it's really bad, and this is something you would do on the test to see when I'm giving someone testosterone, how much estrogen are they making? There are prescription aromatase inhibitors, and inostrozole is one of them, but that's definitely something your doctor would need to talk to you about because it is a prescription. But proper nutrition. You've got to eat the right foods. You've got to eat low sugar foods. How many times do I talk about stay away from high sugar and processed foods? You've got to eat the low sugar foods. Get rid of any and all fructose in your diet. It is killing you slowly but surely. And you got to balance your macronutrients. And unfortunately, since it takes 12 bowls of spinach to equal what one bowl of spinach used to give you 20 years ago, you have to take a multivitamin. So good quality multivitamin that has the multi-minerals in it is key to making sure you have good nutrition, and eat that anti-inflammatory diet. Don't be eating margarine. Don't be eating corn oil, vegetable oil, canola oil. All of those increase inflammation in your diet. Exercise. We talk about exercise all the time, and people think exercise is really hard. The biggest key to losing weight in the abdominal area and to helping your testosterone levels is to do high-intensity interval training. Do body weight, so you can do push-ups and pull-ups in plank position. You don't have to lift a lot of heavy weights. But high-intensity interval training is when you will do sprints or do something as hard and fast as you can for very short bursts of time, and then you rest. And then you repeat it. And you would repeat it 5 to 7 times, and you only want to do that every 7 to 10 days. So it's not like you do it every day. But that is the biggest way to burn that excess fat and to help get your hormones under control and help change your metabolism. Got to balance the hormones, so stop that aromatase. Use the natural aromatase inhibitors, or make sure if you're going to do testosterone, your doctor's really looking at your estrogen levels to make sure you're not converting. Lower your inflammation. High blood sugar causes inflammation, so you got to get your blood sugar under control. Vitamin D replacement. People with low vitamin D have higher inflammation, and after this winter, we're all vitamin D deficient. Omega-3 fish oils. You please, if you're going to take a fish oil, make sure when you open that bottle, put your nose in that bottle and smell it, and make sure it doesn't smell fishy. If it does, please take it back to the store and get your money back. You don't want to burp it or be able to smell it, because it's bad if you do. And then lastly, everybody really at least probably once a year needs to go through a detoxification process. We're so bombarded with toxins, our liver gets completely overloaded. So get a really good quality detox supplement that does phase 1 and phase 2. If you don't know what that is, please call me at Medica and I will walk you through a couple ones that will do that. Limit all your exposure to toxins and the xenoestrogens, which if you look at your lotions, most of them have xenoestrogens in them. Check them on the Skin Deep website. Again, I can help you with that up at Medica. And then make sure that you're supporting that metabolism. If you are a guy who's tested high in estrogen, you can use the Chrysin, you can use supplements like Endoflex or calcium D-glucarate to make sure your body is metabolizing estrogens correctly.
Easy things are exercise and diet, and they're not easy, but that's the way that one can start today.
Exactly.
Don't have to wait for a test to come back. How much roughly does this saliva test cost?
Well, it's interesting. The lab that we've used for the last few years to test for men's test is around $120, I think. You can call me at the pharmacy and I'll verify that. We have 2 new labs that we're working with. Both of them have a lot bigger ability to bill insurances. So there still may be around $100 out-of-pocket cost. It varies on the insurance, but we're really glad and excited to be working with 2 new labs that the prices are a little better and they can sometimes bill insurances. So it's a little new to us. I don't have all the details, but as we work with people in the labs, we'll get that information.
And then inquiring minds have to know. You said today's bowl of spinach, you'd have to have 12 of them to equal, 20 years?
Yeah, about 20 years ago.
20 years ago.
Well, it's like apples the nutrition in apples have decreased 92%, and the nutrition in kale has decreased 96%. That is how deplete our soil is. And so for anybody out there that's like, oh, you don't need a multivitamin, just eat right. They are full of it. And you cannot. I mean, we are so deficient in our nutrients anymore that we just can't get it. I mean, it takes something like 15 apples to equal what it used to equal 1. And so, and of course, that would be too much sugar, and that defeats the purpose. Yeah. So you have to, and I do get, how do you tell a good quality vitamin from a poor quality vitamin? And I'm just here to tell you that New Start has some great vitamins. We have some great vitamins. You cannot find top quality vitamins very often at the big box stores. Or off the internet on Amazon or, Sam's Club and Costco. Do not go buy those great big. This is our brand of it, because they don't follow any manufacturing practices that are good. They don't test their products for pesticides and potency and purity or heavy metals. And they don't test every batch. So a good quality company is going to test every batch of supplement they make. And if it doesn't meet the top quality standards, they're not going to sell it to you. And there are a few and far between. There are quite a few good companies out there, but they're hard to find, and you have to know what you're looking for. And again, we carry Integrative Therapeutics, but there's also Vinco and Zymogen, and there's quite a few different good companies out there. And we're actually thinking about kind of expanding our line to include the Zymogen and a couple other brands to give people more options. But you just have to be careful and make sure you find somebody that knows the good from the bad.
You get what you pay for in everything, and you pay a little bit more sometimes for high-grade gas, and you get a little better gas mileage. You pay a little bit more for higher-grade vitamin, and you'll get more benefit out of it.
And you can tell the difference, and I know I said it on the show a few months ago maybe, but, I challenge people, if you're taking a multivitamin and you want to see the difference, come in and try it. But I want you to take the vitamin for the full 30 days. So if you don't like it, that's fine. Bring it back and I'll refund your money. But I want the bottle to be empty. And I want to see that you've had it for at least 30 days, because I'm telling you, some of the top quality vitamins you can tell a huge difference with.
Well, Alyson, thank you very much, and go Cats.
Yeah, go Cats. If anybody's in Dallas, see you there.
We'll look forward to seeing you on our next show. And this was
Sounds
a
good.
very informative show, and for those that said, "Oh, I'm glad I saw it. I wish somebody else could see it or hear it," very quickly it'll be up on your medical pharmacy website. You can actually watch this is the same video on that on the website. Not long after we actually get it on the radio and on VRTV cable.
Exactly, and then we have a YouTube channel as well. So if you go to YouTube and search Medica Pharmacy, you'll see some of our commercials and stuff, but you'll also see the vast majority of the radio shows.
Okay, there you go. So thank you very much, and have a great April as we get it underway.
That's right. Good April. Let's hope for good weather.
Oh, before we go, let's get the commercial in. Anything new that we want to let our audiences know about? No.
Well, since it is April 19th is the baby fair that's coming up, and we will be there. And as I talked about bad lotions and xenoestrogens, I'm a big promoter of using really good quality lotions, especially on babies whose skin is very, very sensitive to those chemicals. We just started carrying a new line called Earth Mama Baby Angel. If you're familiar with the Skin Deep website, it ranks 0 toxicity, smells wonderful, and actually they have mama lotions too. We actually have a tester bottle for a couple of things, and we're in love with it. And if you're a chapstick person, I think it might be the best chapstick I've ever used in my life. And there's no toxic chemicals at all in any of their products, so they're amazing stuff. We've sold a few. We're getting great feedback from people. We'll have samples of those products at the baby fair. We have a couple testers in the pharmacy, so stop by and test the lotions, and they feel it great. You're going to love them. A few years ago, we did a free vitamin program for kids. We're getting ready to restart that because I wasn't crazy about the vitamins that we had. We have a really good quality vitamin that we found that I'm happy with that doesn't have the added dyes and colors in it. So we're going to try to plan on launching that on May 1st. So kindergarten through 6th grade. But we'll be promoting it and talking to the schools about it. But we're going to be offering that free vitamin program again starting in May.
Okay. And we have the snot sucker out at the baby
We
fair?
do, and we actually a couple of our gift baskets that I guess we give away have the snot sucker in them. And we've actually sold enough that we've had to place another order. And I have a new pharmacy student that started Monday, and she goes, "I didn't know you had the snot sucker. I love that thing. It's amazing."
She must have a baby.
She does, has a 15-month-old. So, find somebody that's used that thing, and they'll tell you that it is fantastic to get those little snotty, cold kids feeling a lot better.
I went home and told Lisa, I said, she talked about the snot sucker, which she uses on the grandkids. I don't. I just sit back and watch and get amazed.
Yeah. The people that have used them love them, and we'll just rave about them all day long.
Alyson, thank you very much.
Thank you.